now coming in as far as what the government strategy is going to be like. And sources are now telling your channel that the government is likely to issue an advisory to all state governments after the Prime Minister's review meeting today. And this advisory is likely to bring back the necessity of wearing masks in public, especially given that we are in holiday season. Christmas is just around the corner, and in another week or so, we are going to be seeing New Year celebrations across the country as well. Arunima, my colleague, now joins us for more on this. Arunima, I believe you have more details of what this advisory could entail.
Yes, first and foremost, Health Minister is going to take both Lok Sabha and Rajya Sabha into confidence. His statement is likely in Lok Sabha at around 2:30 and in Rajya Sabha soon after. So between 2:30 and 3 o'clock, you could see Health Minister taking the parliamentarians into confidence. Assume significance, especially Congress-led opposition was targeting him for saying that, he had politics on his mind when he wrote that letter to Ashok Gehlot and Rahul Gandhi on COVID spreading through the Bharat Jodo Yatra. What Health Ministry officials tell me, functionaries tell me, is that after the meeting that the Prime Minister has called today, there is a very high likelihood that advisories will go out to all states. There is already a guideline which is in place, but most states have let their guards down as far as imposing fines on masks or not wearing mask is concerned. That rule has been eased out. This advisory is likely to underline the need to ask people to wear masks and then leave it to the states whether they want to bring back the fine or just spread awareness. Second thing is that New Year's is down the corner, and New Year's this year, New Year's Eve is over the weekend. So there is even more chances of crowd getting together at various places. So the advisory is likely to ask states to ensure that they avoid crowding as much as possible, and even at places where there are people present partying, they should be advised to wear masks, maintain social distancing as much as possible. On the airport situation, when asked, Health Ministry officials are telling me that already 2% random testing has begun, and the route that has been mapped for the spread of COVID is from China, from Southeast Asian countries to America, and from there to Europe and then to India. So following this route, there is the random sampling that is happening also is keeping this route in mind while screening passengers. For passengers who are coming from China, if their travel history shows that they have been in China over the last 7 days, they are being compulsorily tested. When asked specifically if quarantine measures will be brought in, what functionaries tell me is that at this stage, the infrastructure which had gone lax because COVID numbers had gone down, that infrastructure will have to be brought back. So at this stage, the advisory may not mention anything about quarantine, but there is work behind the scene that is being done so that in the next 7 to 10 days, everything that has to be done to ensure that we don't suffer as much as we did in first and second wave, that kind of a situation is avoided. To quote a government minister, he said, "Chahe jo ho jaye, is baar COVID ko ghusne nahi denge." So that's the kind of motivation that all across the health ministry, all across the government, they have. But one thing in terms of assurance that they are providing to us is that experts feel China is suffering because their vaccine hasn't really worked. In India, that kavach, so to say, is available.
Absolutely, which is also why we had the Union Health Minister yesterday come out and say that all those who haven't taken the precautionary dose or the third booster dose that it's being called, they should also go ahead and do so. And Arunima, the stress is going to be, or the focus is going to be on infrastructure, because we saw how the strain was felt on hospitals, on the infrastructure, especially during the Delta wave.
Yes, and that's also a mode of concern. But at this stage, I think the focus is to try and avoid that kind of a situation where hospitalization is needed. Try and get the numbers in control from the word go itself. That is the focus right now. Awareness is the buzzword that I hear after speaking to those who are dealing with the matter. I think awareness will be the underlined word even when the Prime Minister meets and that advisory goes out, that ask people to not let their guard down, wear that mask, sanitize as much as possible, maintain social distancing. And there's a lot of concern around New Year celebrations. To quote government officials, they say we can't ask people to stay home and not party. If we say that, we will not be taken into account the practicality or the reality of the situation. People have not celebrated for 2 years, and since it is on the weekend, they are going to come out and celebrate. All we can ask them to do is please be careful, take as much precaution as you can, and don't get into a situation where this celebration of New Year's could come as a regret at the start of 2023.
Absolutely. So our guard needs to be up. The awareness needs to be there that COVID is not over. That has been the unequivocal message from the Union Health Minister yesterday. That's perhaps going to be stressed upon by the Prime Minister today as well. For the moment, Arunima, thank you so much for getting us the latest. Dr. Raj